We've seen kids, then they lash out and they're angry. And I will tell you, it's always rooted in something, a way that they're feeling or how they're feeling about themselves. So asking questions allows us to get down to that. Hi there, I'm Dr. Suzanne Simpson, and I want to talk to you today about what teenagers say that they need from us adults for their own wellness and support. If your child is pulling away from you or they're struggling with mental health, this is here. This is why we're here, and I'm going to go through this now. This work is based on my research I did at a youth psychiatric unit. What did teenagers say that they needed from adults as their mental health deteriorated and their substance use increased? There are three main things that I found that the kids say that they need. And this covers the gamut of any challenges with your child, whether it is mental health disorders, whether it is they're feeling disconnected or you're feeling that you're losing them, whether it is you just want to get closer to your kid because we are in a day of screens and distractions and technology, and we ourselves as adults, I think, have a hard time getting off the phone. So I asked 25 kids over a year period, what did you need? And I'm here to share this with you. So here's number one. So easy. They said they needed to be supported. That is it, just to be supported. What does that mean? So support comes in so many ways. It could be that you are helping them through a problem. And by the way, if you don't know the answer to that problem, that's okay because we are all human. But just leaning in to work through a problem with them, even if you say, I don't know the answers, but I'm here for you, that's support. The kids even talked about getting help with a small school assignment, just being there for them and being present within our own humanity. That's being supportive. We're just building them up. When you're there for your kids, their self-worth grows because you're showing them that they matter. The second one that the kids said they need is understanding. Now, we talk about understanding. We kind of know what it is about, I'm understanding what you're going through, although I might not. Let's talk about understanding for a second. So, first of all, to understand means you don't actually have to go through that experience. You are making the effort to try to see their lens. Here's another thing. As soon as we as parents have even a single iota of judgment when we're trying to have conversations with our kids, they're done. This came out in my research. It did. It came out in my research. Kids saying they understood me because they didn't judge me. And so that means when you are talking to your kids, watch your facial expressions, watch your tone of voice. Don't say anything that comes across that you are positioning yourself with an opinion yet, because that's not understanding. I had a really great teacher. Her name's Vicki Ellis. She's on a former podcast that's on audio about understanding. And she said, understanding means taking your head out of your butt. To understand, you have to remove yourself from the situation because we all have our own experiences and biases and perspectives. We can't have that in front of us when we're trying to understand. We have to remove ourselves to understand and just sit there and be able to listen. And also, asking questions is a great way to understand versus assuming. You could say, then what? Or, well, how were you feeling in that moment? Or what are you afraid of right now that you're saying this? We've seen kids, then they lash out and they're angry. And I will tell you, it's always rooted in something, a way that they're feeling or how they're feeling about themselves. So asking questions allows us to get down to that. And then here's the last thing about understanding is considering what's behind the behavior. What is it that is causing my child to act like this? Because if we can get to that, then we can really understand. So if you've got a child like super pissy in front of you, well, just instead of reacting, just scope it out and find out. And again, like ask questions and then what? Because then we can get to the root if we have good relationships. And that is building good relationships with our care. So the kids told me they want support, understanding, and they want care, to be cared for. That's kind of general, isn't it? But we all know when we're cared for. It's leaning in. Caring for, I think, is how we are as beings. I think support and understanding, we do those things. Care is our way of being. So to care for your child, you love them, Does your face light up in the room when they walk in? That's care. Are you wanting to spend time with them? I mentioned the self-worth before, but caring for your child is engaging with them. And it might be something as, they're sick and you're helping them out and you're with them, or Band-Aid. It's just walking alongside with that care. And again, that self-worth goes up so incredibly high when we do that. So support, understanding, and caring. What happens when we do this? I am not a psychologist. I'm not a clinician. I am a teacher. But I will tell you what came out of my research was the kids had connection. That's it. They were connected. I would say 98%, very loosely, anecdotally, that of the kids that I worked with at that psychiatric unit for 5.5 years felt that they didn't matter and that they didn't belong. They didn't feel connection. That's what it is. I had a great psychologist tell me that the opposite of connection is substance use, because you're filling that void. So when kids feel connected, they feel certain of themselves, their self-worth continues to grow. They have people to talk to. Even talking about if your child's suicidal, do you want to know? I just learned this, that the CDC, the Center for Disease Control in the US, back in 2011, put connection down as the number one mitigating factor. The one thing we do with suicidal ideation that would stop that feeling and then the follow through with it. So it's being present, and it's just support and understanding and care. When we do this, also, the kids feel more grounded. So kids who are anxious, for example, they told me they feel just more grounded because they have connections with people. And the other thing that happens is that they are going to be in relationship with you. So you want to talk about conflict in the home, and you want to talk about how to subside conflict in the home. If your kids are connected with you, I can tell you with confidence that there is less conflict because they are attached. There is a really great book called Hold On to Your Kids by Gabor Mate and Gordon Neufeld. And it's about attachment parenting. And what it is that your kids' behavior aligns with their attachment. So if they are attached to you, they will make decisions with you on a Friday, Saturday night. They might be home more, or their behavior would align closer to your values. If your kids are attached to their peers, now we have that very dangerous potential of at-risk behavior where they could be out using substances on a Friday night, being involved with people that you probably don't want them to be involved with, because that's where their behavior is going to fall with that attachment. And everything I just said again comes down to connection, support, understanding, and care. So what you do with this, you've got a kid struggling, you want to connect more, you don't know what to do. You start right there. You start supporting them. How can I support them? Think about that in your own personal life. How can I support? And I'm not against therapy, but they want support from you, the parent. And then how can I understand better? What do I do personally that I can understand my child better, so that when we're in a conversation, I'm not blowing my top, I'm not reacting out of emotion, I'm just sitting there and I'm not judging. I'm asking questions and I'm getting to the root of this, and I'm keeping myself out of the equation. And then the care, right? That how can I care for my child and what that entails? This is all about getting on their turf, all of this with that connection. So join me in another 2 weeks. I'm doing these, just me's are alternating with the podcast. I have so many podcast episodes with people from around the world of how we get on our kids' turf and connect with them more. I am on Instagram and LinkedIn, and you can click like on that little button below and subscribe to this channel and give me comments. I'd love to respond and what you want to know for future episodes. I'll see you next time.